We're going to get more on that UN health report from Steven Hickman, who joins us now live from San Diego. He's a licensed clinical psychologist and an associate clinical professor at the University of California, San Diego's Department of Family Medicine and Public Health. Really great to have you with us, Steven. First and foremost, the WHO's Mental Health Department Director, Devorah Kestel, says that governments need to put mental health at the front and center of their responses. How do they do that?
Well, that's a big question for sure. And I think a lot has to do with the fact that this is not a new problem. So we are certainly facing an upsurge in difficulties of a mental health nature as a result of this pandemic and the anxiety and fear and grief and everything that comes with it. But this really calls our attention to the fact that there's been a mental health crisis in this country and this world for quite some time that is only now coming into focus when we're in these particularly difficult situations, this particularly difficult condition. But we need to first recognize that it is a problem. And so that's actually a good thing that I think is coming out of this situation is we are becoming more aware, the world is becoming more aware of this, of the lack of resources that are available for caring for people with mental illness.
And Stephen, we know that there are people already out there who struggle from anxiety and depression even before this pandemic, but you also have frontline workers who are exposed to just horrible images of death and sickness all around them. And then you also have people that are dealing with isolation. Who would you say, though, is the most vulnerable in this pandemic when it comes to mental health issues?
I think it would be, as you said, people who have already been struggling with these kinds of difficulties of anxiety and depression previously, especially those who are more isolated. So this pandemic is certainly heightening our awareness of how important we are to each other, to put it that way. Our common humanity is what binds us together and gives us strength. And there's always been a bit of a, well, not always, but for years been a kind of epidemic, so to speak, of loneliness in the world. So the people who are most isolated are the ones that are most vulnerable. And I think it's also worthwhile noting that to have anxiety, to have fear, to have grief in the midst of this pandemic is not mental illness. It's a normal human response to difficulty, to challenge, to suffering. And it's helpful to recognize that if you're feeling stress, if you're feeling anxiety, if you're feeling fear and uncertainty, it's not necessarily a sign of any particular mental illness. It's a sign that you're human, that you're actually tuned into what's going on. And it's a reasonable response to these conditions.
What are the societal impacts, Stephen, when mental health isn't managed among the population?
Well, they're really quite huge. If people are not able to be productive members of society because of mental illness, they can't contribute, they can't work, or their work is sort of suboptimal. There are a lot of sick days, so there are costs to employers for people being out due to mental illness that often gets camouflaged as physical illness because that seems to be a bit more socially acceptable to have physical problems, medical problems rather than psychological ones. It's really kind of permeates everything because it's been a bit of a silent negative impact on our society, and that people don't talk about this, and it doesn't get the attention it needs, except in crisis situations like that. So to some extent, I kind of see this as actually an unfortunate but perhaps a timely opportunity to address this particular problem in a meaningful way that's needed this kind of attention for quite some time.
Absolutely. And Steven Hickman, we really appreciate you coming back on to talk about it with us as well. Thanks for that.